Electrolyte imbalance. Dietary requirement of sodium in children is 2 to 3 milliequivalents per kg body weight per day, and dietary requirement of potassium is 1 to 2 milliequivalents per kg body weight per day. So 1 to 2 milliequivalents per kg per day is potassium, 2 to 3 is sodium. Okay, so hypernatremia will be discussed in this video. Hyponatremia is defined as serum sodium concentration less than 130 milliequivalents per liter. Hypernatremia, sodium concentration more than 150 milliequivalents per liter. Hyponatremia, that is low sodium level, it causes decrease in the osmolality of the ECF, that is the extracellular compartment. We know why, because the sodium is the ion which is predominantly present in the extracellular fluid. Because the intracellular space has a higher osmolality, water invariably moves from the ECF to the ICF in order to dilute it. So from the ECF, where sodium is less, sodium is not there, but like inside the cells, at least some other ions are there. So the water tends to move from the ECF to the ICF. So increase in the intracellular water occurs, and that causes the cell to swell. Although the cell swelling is not problematic in most of the tissues, it is potentially dangerous in the tissues like the brain because it is contained in the fixed shell, the skull. As the brain swells, there is increase in the ICT or the intracranial tension. So brain cells swelling is responsible for the most symptoms of hyponatremia. Like for instance, anorexia, nausea, vomiting, convulsions, headache, coma, drowsiness, circulatory failure, hypotension. So the GI symptoms include anorexia, nausea, vomiting. The CNS symptoms include headache, drowsiness, convulsions, coma. The blood vessel symptoms include circulatory failure and hypotension. Hyponatremia can also cause muscle cramps and weakness. Central pontine myelinosis is classically associated with overlay rapid correction of hyponatremia. Treatment of hyponatremia in low ECA volume and asymptomatic patients give ORS, normal saline. In complicated cases like seizures, give 3 to 5 ml per kg of 3% hypertonic saline to raise the sodium by 5 milliequivalents per liter. Never do rapid correction of more than 12 milliequivalents per liter in 24 hours because it causes central pontine myelinosis, CPM. So, as a quick recap, hyponatremia is the cutoff is 130 milliequivalents per liter. We know sodium is supposed to be in the ECF, but then sodium is not present in the ECF. So whatever water is present, the ECF is bored, so it wants to go where the ions are present, which is why it enters into the cells. So the cells are going to swell because there's a lot of water. It's not a problem in most of the tissues, but like in a tissue which is like present inside a skull, inside a shell like a skull, fixed shell like a skull, it's going to be a problem. So in this case, brain has a problem. Okay, so because the brain is getting swollen up, symptoms will be present, and it's all basically because of hyponatremia. The symptoms include GI symptoms, brain symptoms, and blood vessel symptoms. The GI symptoms include anorexia, nausea, and vomiting. The brain symptoms include convulsion, headache, convulsions, drowsiness, and coma. Drowsiness, headache, convulsions, coma. And then blood vessel symptoms, hypotension and circulatory failure. Hyponatremia, skeletal muscles. Hyponatremia's effect on the skeletal muscles include muscle cramps and weakness. Apart from that, CPM also occurs. CPM stands for central pontine myelinosis. When will CPM occur? Whenever the hyponatremia is rapidly corrected. So like overzealous treatment given enthusiastically, hyper enthusiastically will lead to central pontine myelinosis. So treatment in case the person is asymptomatic, give normal saline or ORS, or in case of low ECA volume, just try and give ORS or normal saline, which is like sodium chloride. If it's a complicated case, we tend to rise the sodium by 5 milliequivalents per liter. For example, like if it's the 130, which is like the cutoff, we raise it to 135. Okay, so that is okay. So 3 to 5 ml per kg of 3% hypertonic saline is given. We are not supposed to correct more rapidly, like more than 12 milliequivalents per liter in one day should not be given. It causes